And a very good afternoon to you. My name is Rajah. This is Delta Radio. You're tuned into Let's Talk. It's the show that allows you to tell it like it is. Now, what are we doing today? Well, it's Medical Monday. This is where doctors stop practicing. Nurses stop listening and changing beds. Patients suddenly become cured. Why? Because it's Medical Monday. And Medical Monday means we're talking all things, not necessarily just about patients and stuff, but about how it affects you. With me in the studio are our lovely friends from the Komao Medical group. Very good afternoon to you, doctors.
Hello, good afternoon.
Thank you very much for coming on to Let's Talk and Delta Radio. The first thing we're going to look at, and I want to discuss, and I really don't mind who answers this. There will be certain ones that I will tailor to women and certain to men, but I think generally speaking, when you look at certain medications or treatments that you have, let's take hair changing, hair transplanting and Botox, are there certain medications that A, you recommend a patient takes, or B, does not take, because when you mix the two, you're actually creating a negative effect? Whoever wants to answer this, go ahead.
Yeah, so certainly for hair transplants, the aftercare is really important, and we do recommend certain medications which you need to take afterwards. So obviously painkillers as and when you need it. There is a cream, which is an antibiotic and steroid cream that you need to apply daily to reduce any inflammation and prevent any damage to the grafts. And then we also advise on a course of steroids as well.
Is that steroid or cream?
Steroid tablets.
Tablets
yeah.
and cream, yeah.
Now,
and cream, yes.
That is what you recommend when you have a hair transplant. What would you not recommend to do? Which, I'll give you an example. There's a patient who has a hair transplant, but what we didn't realise or what we didn't know is that he or she's on some repeat medication. Now, what would you say to them? You don't know their medication. What shouldn't they take?
So, for instance, if they're taking steroids, so steroids can cause a lot of inflammation of the stomach. So, any medicines that can also do like aspirin or naproxen or something like this, or ibuprofen as well, if you're taking that along with the steroids, then that can cause some stomach upset. If they've got diabetes, they're on diabetes medication. Again, steroids can cause erratic blood sugars. So, these are things that we need to monitor, and it doesn't necessarily mean they need to come off those medication. It just means that for a short period of time we can add in another medicine, like for instance omeprazole, which you can protect the stomach whilst you're taking these medicines. So you just need to know exactly what medicine they're taking before you give them your own medicine.
So what you're saying is that I guess the responsibility is on both sides, isn't it? The patient must declare to you what they're on, if they're on anything, and you as doctors should sort of look out for what would be an imbalance. Is that right?
Definitely, yeah.
Definitely, yeah.
So, for instance, with the hair transplant patients, we always get a GP. We want a GP summary for that patient if they have it. For some patients, if they there are some who don't have it, or if they've come from abroad, then in this case we have to trust them that they know what medication they're taking.
Let's put it this way. Let's say somebody's wants to have a hair transplant, right? Something they've wanted to have for a long time. They are in their 70s, maybe late 70s. It does happen as older people maybe want to still look younger. That's the whole point. Let's not, beat around the bush on this one.
Yeah.
It turns out that his heart is a little bit weaker, and it also turns out that the medicine he's on, or she, I'm just saying it could be a lady, turns out to really conflict with hair transplant or even Botox for that matter. Now, there is nothing you can do. They have to take that medication. Are there certain circumstances where literally you have to turn around and say, with all the love and respect I have for you, I can't do this surgery, I'm sorry?
Oh yeah, definitely. So for instance, when
That's serious, isn't it?
Yeah, well, you have to. These patients are not suitable for the operation because if they've got a weak heart or if they've got some significant comorbidities, then it's not safe to do the operation. Also, for instance, if they've got diabetes and the diabetes is not under control, then you can get increased risk of infection, bleeding during the operation. So we have to say no to a lot of patients as well. We can't just say yes to everybody.
Is there specific ones where women tend to, you look look at women and think, no, I can't. I mean, special disease, not diseases, but problems that women may have. It could be menopausal, it could be hormonal, it could be where you would just say, I'm sorry, we have to look at an alternative.
So I think for hair transplant, because it's a bit more of a major procedure compared to Botox, then we definitely need to look at that more. Generally speaking, with Botox, the side effect profile is quite low, and generally there are not that many situations when you can't do it. So in that respect, patients have less of a chance of being told that they can't have it, whereas with hair transplant you have to be really careful. Similarly with any surgery in hospital, if a patient is really elderly, has a lot of problems, then even for example hip surgery, if they have a hip, when people are considering hip replacement, then even then you would need to really consider is the surgery worth taking the risk with all their problems. So it's definitely on an individual basis that we'd need to assess it.
We're going to come back after the break. That's a very interesting point you've touched, because I didn't really look at hair transplant as being such a major surgery, but you've actually compared it to something quite major like hip surgery. And we're going to look at how major surgery can affect small surgery. We're going to look at the differences that's going to affect in the long run. So somebody could be like, yeah, you can have it now, but 6 months down the line they're suddenly changing again. And we're going to look at those effects. Plus then we're going to look at, after that, Botox. And I want to go into Botox a little bit more, as the season for Diwali is coming, and people want to maybe, as I think it was teeth grinding, want to stop that. They want to stop things like the odd wrinkle here and there. I'm going to talk about how sensible it is, and what you would talk about when it comes to Botox, and how much you would be prepared to go forward with it. My name is Rajah. This is Dilsa Radio. With me in the studio are our lovely friends from the Komao Medical Group, and we'll be talking all things Botox, all things, I think I'm going to use the word side effect as well. A very good afternoon to you. Good afternoon to you. My name is Rajah. This is Dilsa Radio. You're tuned into Let's Talk, the show that really tells it like it is. By the way, if you want to give our lovely friends from Komao Medical a call, you can do so on 0203 515 1035. And tell me, first of all, have you had Botox? Have you ever thought about it? Have you ever had hair? Is it hair transplant? Is that what it's called, isn't it? That's the official name, isn't it?
Yeah. Yes.
Have you ever had hair transplant? Why? What happened? And tell me how that worked. But in the meantime, we're also looking at the other things, because on Medical Monday, I like to go behind the whole situation. And before I do that, let me tell you, the two doctors with me, Dr. Riya and Dr. Sharma here, it is Sharma, isn't it?
Yes.
Have actually been working a whole night shift trying to save lives. So please, bear with them. They may be a bit tired. I would be too. When I say go behind, this is what I'm saying. Take, for example, Botox. First of all, you've told us very clearly on many occasions it is almost like a liquid gel that is either inserted into a part of the body, if it's teeth grinding, usually the gums and the jaws, if it's a wrinkled shape, usually the sides of the face, or if it's in sort of areas where maybe there's extreme thinning of the bones, it's injected. Now, is there or are there medications you would strongly tell people not to take if they've got Botox?
With Botox, there are a few indications where we should not do it. For one, if the lady's pregnant or breastfeeding, in these cases we should not do it. Other cases, if patients have what we call the medical lingo neuromuscular disorders, so anything where the muscle is affected, there's certain neurological conditions like myasthenia gravis. So these kind of things we need to screen for. And then with regards to medication specifically, so if they're on antibiotics, that's another thing we would advise them, finish the course of antibiotics before, you're suitable for Botox. So if they're on antibiotics or if they've got any infection, then they would not be suitable for Botox.
What about a man?
Same.
You've mentioned pregnancy, and I can't understand that. There's changes in the body. I'm not going to argue there. You've mentioned about women on antibiotics. Again, but are there specific things that men, if they're on, I'll give you an example, Viagra, or even other heart beta blockers, that you would say, hang on, Botox? no, you're asking for trouble?
I think, yes, definitely with beta blockers, because that can slow your heart rate down and you don't want to take the risk of doing Botox in this kind of situation. With regards to Viagra, there's no contraindication with that. But again, for men, if they're on antibiotics for any infection, then again, we would advise not to have Botox during that period of time.
For women, I'm going back to Dr. Riya here for a second. Let's not look at older women. Let's look at younger women for a second. A lot of younger women are good at hiding things, the odd disease, the odd problem. They're good. We're all good at that. We're all victims of doing it when we're younger. No, Mum, I'm fine. I haven't got 104 fever. I can go out and play football. We know we have, right? If you are younger, woman, probably maybe wanting to get Botox done, would you say in any case or in any situation you would refuse to do it? Let's move on, leave pregnancy aside. How about cancer patients?
So I think with regardless of age, young or old, I think you have to look at their medical conditions. You know, what conditions they have. Are they having any active treatment for cancer or something else at the time? And then we have to look at specific interactions with Botox. So, for example, even with other medications, some people who are on statins, you can't prescribe certain antibiotics for them because it will interact. So we would need to judge that on an individual basis. But generally, if you're a young female, fit and well in general, then there shouldn't be any problem, really.
No, but what about a cancer patient?
So cancer patient, I think it would very much depend. So if they're having chemotherapy and, more vigorous treatment, then we would refuse until that's, until that treatment has subsided and once they've reached a state where, they're more stable. But like I said, it's very individual and, there are different cancers with different treatments. So it would need to be judged on an individual basis.
A very important point there. Okay, moving forward. 0203 515 1035. I want to hear from you. Have you ever had Botox? Have you ever had hair transplant? Have you ever thought about having it? What made you think about having it? What put you off? This is your chance to actually ask the questions that people in shops and places, I'm not trying to be horrible, they just don't have the time. They've got lots of patients. This is your opportunity, my lovely friends and listeners, to ask. And if you think that question is silly or not valid, trust me, I don't think it's silly and I don't think it's not valid. It's a question. It's on your mind. Start dialing 0203 515 1035. Botox, hair transplant, private GPs. What's the connection in your mind? And that's the next point I want to talk about when it comes to private GPs. I know that you offer the service and there's no argument about that. In fact, we've done a program on it. But people have been asking me, now that Christmas is coming, Diwali is coming, other religious functions are coming. They're queuing up GPs to check that they can get a facelift, a Botox, a hair transplant, and it's taking too long. Not to get it done, but just to even get to the GP. Can you offer a package at Komao Medical Centre where the GP can give you an answer, can write that report to, say, you people or the Komao group, and get an answer and get a plan going for A, hair transplant, B, Botox? I don't mind. I think because in terms of men and women, I think this is a unisex question. Can you do that?
Yeah, absolutely. So any GP can send us in a referral for a patient who needs any of these procedures. Ideally, if it has a past medical history for the patient, so a full medical summary, what medication they're taking. So yeah, we can make sure that we can give prompt consultation and treatment for these patients. So we're happy to work with GPs, to arrange a referral program, and we do as well. So yeah.
Yeah, this is what I wanted to say. You do that as well.
Yeah.
So one package or one shoe fits all.
Exactly, yeah.
That is a very important point as Christmas is coming up and Diwali is coming up. Tell me, Dr. Riya, have you ever had, or what are the common sort of questions or face, with Botox? What is it that women tend to normally want to have done?
So generally for Botox, so when it comes to sort of wrinkles and anti-wrinkle side of it. So generally it's the lines on the sides of our eyes, so that what we call crow's feet, and also on the forehead line, so the worry lines, or frown lines are here just between the eyebrows as well. So those are the three main areas that women usually want Botox for, and those are the ones we cover usually.
And men?
So similar, but I think with men it's more the crow's feet. They tend to be worried about that the most.
Are there any sort of religious restrictions to any of this?
No.
I mean, I asked you once before when it came to, collagen, there was pigs and stuff in it. But in Botox, it's not like
No, Botox doesn't have... Botox is a purified protein, so there's no collagen or anything. It's just a protein that's made in the lab that's grown from a bacteria culture. So the botulinum toxin is basically a toxin that's produced by the bacteria Clostridium botulinum, and that bacteria it's like, for instance, in any laboratory, you grow the bacteria in a petri dish, and then they're taking the specific toxin, that protein, and then they're purifying it, and that's basically what Botox is.
Do you think that? Well, I mean, I'll ask you a very straightforward question: is this available on the NHS?
So not for cosmetic purposes, no. So the NHS doesn't offer anti-wrinkle injections for Botox, and similarly for hair transplant as well. So that's not offered on the NHS, but that is something that we do offer.
So that is something why people need to come to Komao Medical Group to really turn that round, because the NHS will just say, unless it's a serious issue, accident, we can't justify the...
Yeah.
No, that makes sense. Right. I have to ask the bitter pill now. What kind of prices are we talking about? And before you go into figures, do you offer some kind of a financial way of paying, so not all in one go? And tell us about that, because that's obviously, as Christmas and Diwali is turning up, the expenses rise, but we still want to look good, you know?
Yeah, so we work with a company called MediFinance, and they do offer for people who don't want to pay the sum upfront, then they can pay it on a monthly basis, and all those patients will go through MediFinance, and then they'll get a credit check, and then whatever rate they will pay, they will agree that with the company, independent of us.
Okay, so it's a bit like arranging finance, is that right?
Exactly.
Yeah.
So it's from 6 months to 8 months to 9 months.
Exactly.
Yeah.
Right, we're going to come back in a few minutes and we're going to discuss a few more things. I want to look a little bit more on the tablet side, but I also want to look a little bit more on the hair transplant. I want to know from either of you, from a woman's point, how long a woman would take to get the hair done and how long it would take for a man, and whether it would be longer, less longer, and how you would react, and if you do, with someone that's got it done in another country or from somebody else, the work has been messed up and you have to unpick that mess. How would you and could you go about doing that? My name is Deep Rajah. This is Dilsa Radio. If you want to have a chat to us, 0203 515 1035. Botox, hair transplant, private GPs. Have you ever had them? Come on, let's have a conversation. Good afternoon to you. And a very good afternoon to you. My name is Deep Rajah. It's Medical Monday. You can talk to my lovely doctors here, Doctors Riya and Doctors Sharma from the Komao Medical Group. We are looking at three major areas here: Botox, hair transplant, private general practice. But what I'm also looking at here is the idea of medication and medications, side effects on these sorts of things. Again, doctors, let me ask you this. We spoke about some heavy medication which could be dangerous, like ibuprofen and things, but everyday medication like paracetamol or Disprin or aspirin, it can have quite a side effect, can't it? Is that what would you say that everyday medication would be or should be avoided if you are taking or if you are having hair transplant, Botox, or any of those areas which the Komao Group specialises?
So I think the main one is aspirin, because if you're taking aspirin, then that is naturally it's a blood thinner. So if during the procedure you can have more bleeding, and if there's more bleeding, there can be a bit more complication. It's not completely unmanageable, but it's best advised that if you are taking aspirin, to stop it at least 1 week before the procedure. But again, if you have got any chronic medical conditions like heart problems or suffer with clots, then you are not really a good candidate for this procedure. Hair transplant is, we're very selective when we do the procedure. We have to do a thorough medical screening, because there's no point in taking the risk of having all these medical comorbidities for the procedure. It's just not worth the risk.
So a person who's had a heart attack and has been told to take an aspirin a day, I don't know, that's old story. I don't know whether that still happens in the medical room, but I do remember a lot of people were told to take 1 aspirin a day and everything. Would you therefore say to that person, no?
Yeah, I would not do any procedure on that patient. If they've had a heart attack and they're taking regular aspirin, it's not worth the risk of stopping them taking the aspirin for a hair transplant. It's just, you have to say, no, that's not a suitable candidate for the procedure.
Very good point. Okay, I'm going to turn this around because we haven't got a lot of time left, but I want to just turn a scenario around here. I'll ask you, Dr. Riya, here. When it comes to, for example, a Botox person who says to you, look, I'm a lady, it's Christmas time, I want these wrinkles off me, or I want this crow's feet off me. How quick can it happen? Not the appointment, but I mean the effects of seeing it. 1 week, 1 month, 3 months? Is it unrealistic to come in and say, I want to look like A and come out looking like B? Is that all just film talk? How realistic is this?
So it's actually surprisingly very quick. The results are almost immediate. Sometimes you can see it on the day, but generally we say to wait 1 to 2 weeks before you see the maximum or the best results with regards to relaxing of the muscles and allowing the wrinkles to diminish. So within 1 to 2 weeks, I would give it that time period if you are wanting to go, if there's a wedding or something and you want it before that.
Yeah, I mean, it's exactly what I'm thinking of. Look at the Diwali coming up and look at the wedding season coming up, and then look at Christmas coming up, and then look at New Year's. Can I just walk in on a Friday and hopefully have walking on a Monday and by Friday see the difference?
Yes. So, but definitely by the following Friday, definitely. But often by the within a week you can see the results.
Dr. Sharma, what about hair transplant? How long would that take, and when would I see the difference?
So hair transplant is very different to Botox. So like Dr. Riya says that the Botox affects 1 to 2 weeks. Hair transplant, you've got to wait at least 6 months to 12 months before you see the results of the transplant. 6 months is when you start seeing the hair growth quite significant, but 12 months is when you get the maximum results of the procedure.
Do you think that, have there been really sort of serious cases where hospitals have had to get involved, or generally is that not the case? It's okay?
Generally, it's not the case, because if you do thorough screening of the patients and make sure there's no medical comorbidities, check there's no allergies to the anesthetic you're using, you shouldn't really get to that situation.
And the other sort of beneficial thing is because hair transplant is done under local anaesthetic, so again it speeds up recovery and there's less complications versus a general anaesthetic. So the patients.
Very good point. So there's no general anaesthetic involved.
No.
Okay. What's the youngest patient you've ever actually performed this on, and the oldest one? Let's do it that way.
So for hair transplant, the youngest I've done is 25, and then for the oldest, this was when I was training with a very well-esteemed surgeon in Italy, was 60 years old. So that's the highest I've gone up to.
And if you think that the patient you're seeing has enough hair on their head, but they don't, so we're talking a clash of opinion here, and I'm sure that's probably happened. A, does that happen a lot? B, what kind of discussions are we talking about here? So, here we come, a lot of hair on my head. I say, no, I still want a hair transplant. You say, no, I don't think you need it. Can they get quite convincing? Do you still do it, or?
So surprisingly, that happens a lot both ways. So it does, yeah. So it does. So you get especially young patients who have had a little bit of hair loss from the crown. So in these kind of situations, you would advise the patient, look, just wait a bit because you're quite young already. Try some medication which we can prescribe just to get that extra bit of hair growth. Before you go down for an operation, because if you're having a hair transplant at that young age, you're very likely to need at least 2 or 3 more of these procedures later on in your life, because it shows that your hair loss is quite aggressive. On the other hand, you also get patients where they don't have enough hair for you to get complete coverage of the scalp, and it's trying to explain that to those patients, because a lot of people think that with a hair transplant, if you're very very advanced level of balding, that I can get a complete coverage. I look like when I was 20, but that's not the case. You've got to work with what you've got. It doesn't mean we can't operate on those patients. It just means managing expectations.
That's the key, isn't it?
Exactly.
You can't go in thinking, I'm now 50 something, my hair is lost, I can walk in looking 25.
Yeah.
Is that the same for women though? Because when women lose their hair, it's a lot more of a serious thing, isn't it?
Yeah. So the hair loss in females is actually a lot more complex than in men, and generally speaking, because the surgery is a lot more complex for women, and because their pattern of hair loss makes it more complicated, we tend to avoid doing hair transplants on women unless absolutely necessary, and we prefer to use other methods like medications and things in the first instance. So with men, it's a lot easier to do it in, but I think at the end of the day, it's all about managing expectations. So, for example, Dr. Sharma, like, if you know what I'm saying, so he's had a hair transplant himself, and his main hair loss was on the sides, but also on the back. So, but with the amount of coverage he had, so they agreed, we'll cover the sides and we'll leave the back for maybe later, or maybe we can do some injections later to help the growth. So it's all about working with the individual and coming up with the best possible outcome.
Yeah. No. Okay.
Exactly.
Last but not least, because time is again catching up with us, if I want to see you, A, can I walk in the door and get an appointment the same day? And B, if not, how much time should I sort of factor in before this?
So if it's a GP consultation, you will need some form of photo ID so we can register you. So we can't treat you unless you don't have ID. With regards to Botox and hair transplant, you can walk in on the day, but we are quite busy, so we do prefer, like, if you call in advance so we can book you in for a consultation, meaning we can give you more time.
Okay.
And Botox generally we can actually do on the day after we've given you the information, and if you're happy to go ahead. But with hair transplant, once you've had your appointment and discussion with Dr. Sharma, then we give you 2 weeks to think about it.
Okay, last but not least, I think very important here, if somebody wants to get hold of you at the Komao Medical Group, what is your telephone number? What is your email? And, let's say, what time are you open till? I mean, how does it work? Walk in or out?
Yeah, so we open Monday to Fridays, 9 to 6, and Saturdays, 9 to 1. Our telephone number is, Dr. Riya?
0208 749 4640.
749 4640. And your website?
Is Komao, KOMAO .org.uk.
And are you on the Twitters and stuff like that?
So Instagram, so it's Komao _medical.
That's very useful to know. I'm assuming there's pictures and things on there.
Yes, exactly.
And you're not far, right? You're only in Hammersmith, is that right?
Yeah, so it's a 5-minute walk from the Westfield in Shepherd's Bush.
Okay, well, Doctors Riya, Dr. Sharma from the Komao Medical Group, thank you very, very much for coming on to Dilsa Radio again.
Thank you.
Thank you very much.
Botox and everything. We'll do it again next week, and we're going to look at a different aspect. And by the way, guys, if you're interested in talking about things like this, or you've got a problem that you want to talk about in terms of medical stuff, maybe they can actually answer this. So you can call them on 0203 515 1035. My name is Rajah. This is Dilsa Radio. You've been listening to Medical Monday. Very good afternoon to you.